Don Manzullo, Illinois 16th District. He voted against Obamacare Sunday night. Congressman Manzullo, welcome back on to the Michael Coolidge Show.
It's good to talk to you, Michael.
Let's just start off asking just what you generally feel about what happened on Sunday night.
Well, it's I don't know. I mean, I've been at this for a little bit, and we've seen some votes take place. This probably was about the most egregious reach of pure raw political power and backdoor chicanery, which is why people hate Congress. And it's Chicago politics all over again.
I can't remember a time where I personally was so angry at our elected leaders in Washington my whole lifetime. I mean, even elections, like, those of us who didn't support Barack Obama, or weren't happy when he got elected, I wasn't angry in November of 2008. I was like, okay, this is what happens, election cycles. Sometimes the other guys win. But people are livid about this, Congressman Manzullo.
Well, they should. They should, because the American people have been speaking for a long time that they don't want one bill that dramatically changes 1/6 of the economy, written with especially members from the Senate who are selling out. I mean, I don't know what word you can use for a member of Congress that sells out, except they should be thrown out at the next election. And you can start with Ben Nelson of Nebraska. I mean, he got the special deal on the Medicaid package, and Senator Nelson from Florida. Now, his constituents get to keep Medicare Advantage.
Yeah,
mine can't. Now, you tell me how that's fair in America when you have a plan that's working that people like, and they can't because their senator sold out for a vote. I mean, this is, and there's $100 million going to a hospital in Connecticut. I don't know which senator sold out on that one in exchange for a vote. In exchange for a vote, they sell out their... Michael, it's so outrageous. And then it reached the zenith when Bart Stupak really went back on his pro-life bona fides and got a worthless piece of paper from the President of the United States called an executive order saying that federal dollars will not be used. I mean, executive orders don't trump clear congressional enactments.
Right.
And so it's the President said that people weren't concerned about process, they were concerned about the results. Well, that's like saying any means are necessary in order to accomplish the results. And that's, Congress has a 19% approval rating. I would give it a 0 approval rating after what happened in the trade-offs going on the floor and in the back doors of this so-called health care reform bill. But when people start to find out what's in it, we've had a lot of people call the office with a very legitimate problem of not being able to get insurance because of pre-existing illnesses. And the adults, we have to tell them, you'll have a remedy in 4 years. By the way, there's a state pot for assigned risk, a pool that has existed for years. You have to wait, plus it's expensive to get into. And there's going to be a little money put into that, and I hope that'll keep you over until 4 years from now when you might get a different policy. But the taxes begin immediately, and these are just crushing taxes. $569 billion in new taxes, cuts in Medicare for seniors by $530 billion, 2.5% tax on medical devices. When Frida came down with cancer 4 years ago, the tumor blew out her vertebrae, exploded it, and the neurosurgeon had to go in there very carefully and remove that bone shrapnel from near her spine. And he put into her spinal column a titanium vertebrae, adjusted the post. It's an incredible contraption, and that's what keeps people from getting into wheelchairs. And that type of device is called a medical device that would be taxed under this health care bill. The radiology machine that killed a cancer, above and below that area where she caught cancer in the back. That would be taxed. And how can the Democrats gloat about this bill saving money, while at the same time it increases the cost of medicine by placing a tax upon medical devices? It's just unbelievable.
I'm glad you brought up that example, because I've talked to many doctors who, and I'm sure the doctor who implemented that on your wife, and the scientist and doctor who came up with that device is right now really seriously considering getting out of the medical profession. I mean, right?
It's happened. The real sleeper in this is that the Pelosi bill prescription for getting health insurance for people is to put 16 million more people on Medicaid. That would be another 330,000 in the state of Illinois, $400 to $600 million more in Medicaid, and under the bill that passed, the states would have to pick up a good portion of that under the so-called reconciliation bill. Even when that passes and is signed into law, if the government doesn't want to fund the states for the increased liability under Medicaid, they just won't do that. And doctors now don't take Medicaid assignments because, or many doctors won't take it because of the low reimbursement.
Right.
In the state of Washington, Walgreens has decided not to take prescriptions from Medicaid patients because the reimbursement isn't high enough. And so why would you want to increase the program by 16 million people when that program is already on the verge of bankruptcy, if not already there? You would end up with coverage, but you might not get anybody to take you in the office.
Right. On paper, you can say, I'm insured.
That's
but
right.
It may take you months and months, if at any time at all, to get actually, some medical attention given to you.
Well, the state of Illinois over 5 years is about $1.8 billion, and you know what's going on in the state. I mean, it's a shame. I mean, you have a lack of income coming in, and thousands of teachers.
Yeah, I mean, it's not just medical people who aren't being
laid
paid.
off.
Right.
It's really sad.
We're speaking with Congressman Don Manzullo, of course, voted against the bill on Sunday night, and you have some insight to this that not many other congressmen in Illinois have, and that is because, I mean, you saw this from back in 1993, the last time major health care legislation like this was attempted. Could you compare and contrast what happened after Hillary Care, as they called it, did not pass in the early 90s, and this one now?
Yeah, it didn't come to the floor for a vote. They had Hillary Care, Bill Clinton and his wife talked about it starting in January of 93 when he was sworn in. The legislation never got cobbled together, and there was never a floor vote on it. And then by the midterm elections in November of 94, people were fed up with all this talk about dramatic change in their health care. That was one of the reasons for the dramatic revolution that led to the defeat of many people who were in favor of that particular piece of legislation. People are just fed up, Michael, with government. It's not so much the issue of medical care that's important. The issue is freedom. We have a lot of people that called our office that have very difficult time getting care because of pre-existing illnesses. And this bill does not help adults. And I think I mentioned that they have to wait 4 years to get some help on it.
Right, it's just children immediately.
But the children are already covered in our S-chip. The other thing that it does is that we could lose between 3 and 5 million jobs because of the harsh employer mandate. You know, every time you make it more expensive to make things or do things here in the United States, that's more of an incentive to offshore. I was talking to a manufacturer of surgical equipment, and he said, you know, I make this piece of equipment. We've been told that if this 2.5% excise tax goes on, that they're going to consider buying it from China, because the Chinese will seize upon the issue and they won't pass through the 2.5%. They'll just continue to undercut so they can get more and more market share. So we could lose more manufacturers.